Everyone, welcome back to the Health, Environment, and Technology Committee. The committee will now move on to Resolution 21-0039R, Violence Against Women and Overlooked Public Health Crisis, for the purpose of inviting the Police Commissioner of the Baltimore Police Department, the Health Commissioner of the Baltimore City Health Department, the Baltimore State's Attorney, the Director of the Mayor's Office of Neighborhood Safety and Engagement, the Executive Director of the Mayor's Office of Children and Family Success, the Sheriff of the Baltimore City Sheriff's Office, and certain community-based organizations to appear before the Baltimore City Council to discuss the rise in violence against women and what strategies are being put in place to reverse this epidemic. For this hearing, we're going to start with brief introductory remarks, Then we will hear reports from the agencies and give committee members the opportunity to ask questions. After that, we're going to move on to public testimony. I'm going to start at this time with my remarks. Violence against women is a pervasive problem that plagues women everywhere. Baltimore City, unfortunately, being no exception. During the April 19th City Council meeting, I mentioned that since 2007, 394 women and girls were killed in Baltimore City, averaging out to 26 female lives lost each year. It's also worth reiterating that in 2020, we saw this number rise to 49, the highest number of women and girls whose lives were taken in the history of the city. When 25% of women experience domestic violence and 50% of female victims of homicide were murdered by either a current or past romantic partner, the correlation between the growing rate of women and girls losing their lives in Baltimore City and the national domestic violence epidemic is clear. Not only is there a cry for preventative action from our city's female population, but rehabilitative care must also be made a priority. Victims and survivors of domestic violence face not only a higher likelihood of future domestic violence, but a host of physical, emotional, and mental health complications as a result of violence from their partner. Physically, female victims of domestic violence are at a higher likelihood of contracting STDs, as well as being subjected to unwanted pregnancies from forced sexual intercourse. Women in violent relationships are 400% more likely to contract HIV than those in nonviolent relationships. Stress factors from being threatened emotionally or physically by a partner also encourage the development of PTSD, depression, and certain chronic illnesses related to high stress, such as heart disease or diabetes. When women become at risk from an abusive partner, so do their friends and families. And thus, the city must also be aware of how violence against women radiates outward, affecting children living in a household, close friends of the female victim, and family members who may not recognize that there's also a threat against them. I want to thank everybody for coming today to this hearing as we continue to address this epidemic and saving women and girls from violence. At this time, we're going to hear from agency representatives. Committee members, I'm asking that you hold your questions until we have heard from all of the agencies, and we're going to start with our police department.
We cannot hear you.
We're going to start with our police department at this time. Did you guys hear any of my statement?
No. Yes, ma'am. We heard your
Okay.
statement. Guys, woman, I'm trying to let Michelle know. She's trying to give the introduction. Can you be heard? Can you try again, Michelle? No. So I apologize. We're going to move on and I'll just take over. Thank you so much, Councilwoman McCray, for inviting us to this hearing today. And thank you so much, Director Wurzberger, for pulling us all together. As you very well know, Councilwoman McCray, we appreciate your hard work with this resolution and bill, and for all the agencies that you pulled together today to speak on violence against women and the support and resources that are needed to help women escape their abusers and heal from the trauma that they may be experiencing as a result of violence. From our statistical review, thus far this year. In I'm going to share statistics that go against 2020. So for 2020, we saw 19 females whose lives were lost, and in 2021, we have seen 20. For shootings, we have seen an increase as well, from 29 incidents in 2020 to 42 in 2021. For aggravated assaults, we have seen 873 crimes in 2020 and 909 in 2021. For the crime of rape, in 2020, we saw 87 cases, and now in 2021, 103. Domestic violence aggravated assaults have increased from 394 in 2020 to 477 in 2021. Aggravated assaults in 2024, women were 873, and again 909 in 2021. We are also, as a police department, working on our group violence reduction strategy, our focused deterrence model, in an effort to be able to systematically address overall violence in the community with our partner from the Mayor's Office of Neighborhood Safety and Engagement and the State's Attorney's Office, to reduce, with an evidence-based approach, to reduce overall group violence that has influence on violence against women. All members of our agency have adopted a victim-centered, trauma-informed approach to domestic violence as well as sexual assaults. All members have gone through a new training, sexual assault training with partners, to include our Mercy partner that has been approved by the monitoring team and the Department of Justice, to ensure that all officers treat victims with respect, patience, compassion, and professionalism, and to refrain from expressing blame, judgment, or disbelief on victims. All reported rapes and sexual offenses are to be fully investigated in an unbiased manner, and all of our officers are trained as such. We have our special investigation section that is headed by Major Bishop, who is joining us today. She is beside me. She will talk about our sex crimes unit and our family crimes unit that help to support the investigations where women are also involved. And I will have Major Bishop provide some further detailed information.
Good morning, Chairwoman McCray and members of the committee. I'm Major Bishop. As the DC has said, I'm the commander of Family Crimes Unit as well as the Sex Offense Unit within the Baltimore Police Department. Both units investigate crimes largely against women. Both units take a victim-centered and trauma-informed approach that ensures that all officers and detectives conduct comprehensive investigations and display the utmost regard for victims' physical and emotional well-being. The Family Crime Unit investigates domestic violence incidents to seek protection for the victim, offer advocacy services, and deter further violence. To meet these goals, the unit initiates investigations in a non-traditional manner to locate and identify households where domestic violence may be occurring. We are a proactive unit identifying households where domestic violence is occurring, as I just mentioned. We review certain agency categories, calls for service. We review incident reports, and we also accept referrals from community associations, victim advocates, and other government agencies. When using the victim advocate services, they help with paperwork to get protective orders and attending hearings with the victims. They help to identify emergency housing and other services. We also have a database to track domestic abuse to identify patterns and help with case development. Detectives work 24/7 to respond to calls as needed. We have a partnership with the House of Ruth as well as Turnaround. And now I'm going to just tell you a little bit about the Sex Offense Unit, because both units deal with most female victims of crime. The Sex Offense Unit mission is to provide justice and support for victims of sexual assault, identify and remove offenders, and complete professional, thorough investigations. We investigate all claims of rape and sexual assault. We coordinate with victim advocates to make sure the victims feel comfortable, safe, and felt heard. The unit works to limit the number of times the victims has to talk about the assault. Interviews of victims must be conducted patiently, skillfully, tactfully to ensure that victims' long-term health and well-being are not jeopardized. Victims are not interviewed in suspects' interrogation rooms, where this was said before in the past. We no longer practice that. We have what we call safe rooms, where a victim can go in with their family members and feel comfortable and won't have to be in the same area where we're taking suspects. And the rooms were specially designed for the unit, and they're a peaceful and comforting area for the victims.
And to that end, Councilwoman McCray, that concludes our presentation from the Baltimore Police Department. Thank you.
Thank you, Deputy Commissioner Briscoe, Major Bishop as well. We're going to move on to our next department. That's going to be the Health Department.
Thank you, Madam Chair. DePaul Niver on behalf of the Baltimore City Health Department. We stand by our report, and in our report, I should mention that we include a number of different downstream and upstream supports that we do around domestic violence. We do treat it as a public health issue. So with our youth, we actually engage in course curriculums where we talk about dating violence, where we try to train our youth to spot violence and situations where intimate partner violence is occurring. And we provide resources, linkages to care for individuals that have been experiencing violence. In addition to what we do with youth, we also have our maternal and child health program, wherein we do screenings. And so we do ask a series of questions, especially for pregnant and or lactating women. And that occurs with our partners over at Healthcare Access Maryland. And then our staff actually engage in home visiting if there is a positive indication of intimate partner violence. So there's a number of different items included in our report, which again, we held a favorable opinion of this particular bill on, and so we're going to request that. We have two staff members here that are available to answer questions, should there be any, in addition to whatever you might have. Yeah.
Thank you, DePaul. Next is going to be the Mayor's Office of Neighborhood and Safety and Engagement.
Thank you, Chairwoman McCray and committee members. With regard to our position, we have submitted our bill report. With me is the Associate Director of Policy Planning and Coordination, Nick Wilson, who has prepared our report and who provides the majority of support around violence against women out of our office. Our agency position is one that supports the passage of this council resolution. We remain deeply concerned about the increase in violence against women, and we're committed to preventing intimate partner violence, or IPV, sexual assault, and community violence. We agree with everyone's position here that it will require a collaborative approach, which looks at evidence-based indicators and tools to assess the risk of homicides and connects victims at elevated risk of lethal violence to immediate crisis intervention, ongoing advocacy, and referrals to comprehensive services. So we welcome this discussion, and we are grateful and encouraged that you all are having it. Not surprisingly, we know that one of the impacts of COVID-19 has been the prevalence of intimate partner violence and its victims nationwide. The pandemic has unfortunately fostered increases in a range of stressors like unemployment and financial instability and parental stress, which are associated with IPV. We're seeing rising tensions and persistent confinement as a result of stay-at-home orders. Imagine no longer having the boundaries, if you will, of being able to go to work or just simply to go outside to take a breath or to step away from a potentially high pressure environment. And so what we've seen is a pressure cooker for explosive behaviors that have resulted in exposure to serious harm or death for women in our city. We know that the first homicide in our city this year was an act of intimate partner violence of a same-sex relationship where we unfortunately had a female perpetrator and a female victim. Historically, we know that IPV victims are often hesitant and reluctant to reach out to services or to contact law enforcement for fear that nothing is going to be done or that they're going to be victim blamed or that what will be done is going to go against their wishes or cause instability for their family. And even folks that are bystanders who are contemplating whether or not they want to support a victim, particularly in communities of color like those in Baltimore City, there are a lot of concerns that are rooted in systemic racism and fear of oppressive behavior, or simply just not being believed, are contributing factors to why victims of color really say that they don't seek assistance and they just try to hang tough and stay in there. Due to the rising frequency and the severity of abuse since the pandemic, Baltimore is seeing a change in the help-seeking behaviors of victims. A recent study that we've taken a look at that compares law enforcement and emergency hotline calls for domestic violence during COVID-19 for 7 jurisdictions showed us that there's been a sustained increase in both domestic violence-related calls for service to the police per day and domestic violence related emergency hotline calls per day for Baltimore City. In fact, Baltimore was one of only 2 cities to see an increase in both the IPV related police calls for service and IPV related emergency hotline calls. These trends obviously demand a strong coordinated community response and a dedicated work group in Baltimore City focused on analyzing these efforts. Reducing IPV homicides requires an increased awareness and coordination between both survivors and agencies who are focused on minimizing risk and increasing safety for folks, as well as proactive measures to ensure that the systems that we create that focus on offender accountability are synchronized. MONSE recognized this need very early on, shortly after I became the director of this agency, in partnership with Nick Wilson and other team members here in MONSE. We applied for a grant from the Office of Violence Against Women in partnership with the Baltimore Police Department, the House of Ruth, and Mercy Medical Center. We'll be notified in October about whether or not we're going to be awarded that $750,000 to support a multidisciplinary team focused on reducing IPV, sexual assault, and dating homicides. We're also working to reconstitute the Criminal Justice Coordinating Council. Until that council got disbanded in 2017, the Domestic Violence Coordinating Council was probably its most productive committee. It is MONSE's recommendation that as we reconstitute this council, that the Domestic Violence Committee be the first among the CJCC's committees that we establish, with the goals of increasing the capacity of Baltimore City to identify and respond to domestic violence risk factors across multiple pathways, improving the city's efforts to reach more high-risk victims of domestic violence and connecting them with coordinated services, improving the city's efforts to leverage more offender-focused models to victim safety to reduce IPV-related homicides and the percentage of IPV-related crimes to total Part 1 crimes in Baltimore City. And the committee's also going to be asked to focus on strategies to reduce domestic violence among our high-risk populations. We know that those are Black people here in Baltimore City and those within the LGBTQ+ community. In addition to focusing on addressing the needs of victims, we want to make sure that we talk to you all about the perpetrators of violence and the potential perpetrators of violence, because MONSE understands that many perpetrators of violence have been victims of violence themselves. You know, and not to be cliche here, but we know that hurt people hurt people. The House of Ruth's abuse intervention program is working every day to increase the safety of victims of intimate partner violence by holding batterers accountable and teaching them nonviolent relationship skills. And MONSE remains committed to supporting and expanding programs like the House of Ruth, who are trauma informed, and other programs that are focused on changing the behavior of domestic violence perpetrators and holding them accountable. We also operate a visitation center, which provides safe and family-friendly supervised visitations and monitoring exchanges for children and families who are impacted by domestic violence, and we do that at no cost. Just going to talk about two other things here, if time allows, Councilwoman. Is it all right for me to continue?
Yes, it is.
Thank you. Just want to be mindful of any time restrictions that I might have. So with regard to additional work that we are partnering on, back in 2014, a model domestic violence policy for Maryland law enforcement was developed by BPD, the Maryland Chiefs of Police Association, the State Police, and the Maryland Sheriff's Office. That model was updated in 2013 to include a lethality assessment program, or LAP. BPD's victim advocates, which you already heard some conversations about, administer the LAP and send the assessments to the House of Ruth for follow-up. House of Ruth offers comprehensive services, including immediate access through a 24-hour hotline, client service coordinators who work with victims to provide safety planning, basic needs assistance, resource referrals, free legal services, individual and group counseling, therapeutic and enrichment services for the children of victims, and abuse intervention through Gateway Project, and other programs that are really meant to be emotionally, physically supportive to folks who are dealing with emotional, physical, and/or sexual abuse by a partner. MONSE recognizes that the dynamic nature between domestic violence risk and the risk assessment tools aren't the only predictor of lethality, but they can be effective in increasing self-protective actions by victims of IPV. And so the process of risk assessment with the survivor gives the service provider access to the gold standard of information about the violence that occurred in the relationship, but it also makes the survivor a partner in the assessment so that they can assess for themselves the extent of their danger. Another way to put this is that the LAP strength is about providing a tool for law enforcement to make decisions with and for women, and also in providing tools to increase information that they should have when making decisions for themselves. So MONSE coordinates a LAP work group, which explores the role of risk assessment currently, and what that should look like as it relates to prosecution, pretrial release, probation conditions, repeat offenders, fatality case review, and other things. The last couple of notes here is that in 2011, the city established a sexual assault response team, or SART. The SART coordinator position is housed within my agency and is currently grant funded through the Victims of Crime Act, or VOCA, that's administered by the Governor's Office of Crime Control and Prevention. The SART team is made up of members of law enforcement, advocates, hospital staff, and prosecutors, and the team meets every other month to talk about trends and areas of concern and strengths as it relates to supporting victims of sexual assault. On alternating months, the members meet and they complete case reviews of all of the unfounded cases. As a result of the efforts between BPD and the SART team, Baltimore's reporting of unfounded cases fell from a national high of 30% to 4% in 2019. So what that means is that BPD's had 2 sexual assault cases identified as unfounded in 2019. When looking at 2018, we saw 15 cases as unfounded. So this can be directly attributed to the SART team's review process, which reviews each unfounded case to make sure that the finding of unfounded is accurate. We want to make sure that we're supporting survivors of sexual assault and standing by them as they make these claims. The last note here is that Monty's always going to remain committed to developing and improving strategies to reduce gun violence. And you all know that our flagship violence reduction program is Safe Streets and aims to prevent gun violence in our communities. In partnership with BPD, the state's attorney, we're also preparing to launch the group violence reduction strategy or focused deterrence. And this strategy really relies on a strong collaboration between community members, support and outreach providers, law enforcement, and others, so that we can engage directly with those who are most intimately involved with and affected by gun violence to keep them safe. This translates directly into this conversation because you spoke in your opening comments about the uptick that we're seeing in the fatality numbers against women, specifically as it relates to intimate partner abuse. And these two programs are just examples of significant investments that the mayor is making with regard to reducing gun violence prevention, reducing gun violence in Baltimore City and creating a preventative infrastructure. So we look forward to continuing to work with you, remain in very strong support of this, this resolution, and we're happy to answer any questions. Thank you.
Director Jackson, thanks for the wealth of information that you provided right now and that also you and Mr. Wilson compiled within the report. We truly appreciate it. We're going to move on to the next department. That's going to be the Mayor's Office of Children and Family Success.
Madam Chair, I'm Leah Ferguson from the Mayor's Office of Children and Family Success. We very much acknowledge the severity of women in Baltimore. Our office doesn't provide any direct services or programming in this area, but are aware and make frequent referrals as needed to both the Mayor's Office of Neighborhood Safety and Engagement and the Mayor's Office of Homeless Services when those.
Thank you, Leah. We are going to move on to the Sheriff's Office. And thank you for joining us.
Thank you, Chairwoman McCray. I'm Major Gruz from the Sheriff's Office. I'm just talking about what we do at the Sheriff's Office with domestic violence. We have a domestic violence unit that has 12 deputies, 2 sergeants, 1 lieutenant. We serve all the temporary protective circuit court and district court, as well as peace orders. For 2020, we made 217 arrests and recovered 37 handguns on domestic violence cases. During COVID, from March 25th to June 5th, we took over the interim protective orders from the police department. And we have 3 advocates at North Avenue. Literature containing resources for victims of domestic violence. So far this year,
Major Gruz, I'm sorry to interrupt. It looks like you may be having some technical issues. Do you mind just briefly turning off your video? And that may help out with the connection. Thank you.
okay, can you hear me?
Yes,
Hello?
we can. Yes, we can.
Okay. So did you hear anything I said?
We heard majority of it. I just want to say maybe the last 20 seconds we were missing.
Okay, so we have 3 advocates at the North Avenue District Court. They interview petitioners when they come in to get their protective orders, and they hand out literature containing resources for victims of domestic violence. And so far, year to date 2021, we have served 973 orders, made 117 arrests, and recovered 58 guns. And that's all I have at this point.
Okay, and thank you so much. Thank you so much, Major Gruz. We're going to move on to the State's Attorney's Office. Again, thanks for joining.
Good morning, Madam Chair, council members. My name is Yusuf Ahmad. I'm the Director of Legislative Affairs for the State's Attorney's Office. We support this legislation discussion and support for encouraging the development and strengthening of effective prosecution, victim-centered law enforcement, and court strategies to combat violent crimes against women in Baltimore. BPD and the mayor's office touched on some of the existing partnerships that we have, like GVRS and others. So I will try to be brief, but go into some of the things that are central to the state's attorney's office, and we'll welcome any questions afterward. Up until 2020, we received a grant funding from the state for VAWA, the Violence Against Women Act, in which we receive funds for a prosecutor dedicated to prosecuting crimes against women, and also some technical assistance. As is the case with grant funding in our office and across the state, because of the pandemic and other financial woes, funding was cut, and we rolled those duties of that prosecutor into our office so as not to lose any ground made during the previous grant periods. The State's Attorney's Office also has a robust victim witness support program. Since 2015, we have secured roughly $8 million in grant funding through various sources. These grant funds underwrite the program and any ongoing campaigns to support victim witness assistance. We've hired 20 advocates that are assigned to our internal divisions to help victims and witnesses of crime through the judicial process. In the initial year of 2015, we were able to serve about 546 victims and witnesses of crime. However, in the past 2 years, we've increased capacity and now serve on average 8,500 annually. Going over some of the data points this morning, roughly 65% of the population served in that given year was female. In 2018, we also unveiled trauma-informed therapeutic victim witness services waiting room in the Mitchell Courthouse, renovated to create a more welcoming space for victims of crime and to receive services as they await their appearances in court through our many partnerships. The renovation included a dedicated play area for children, so families and victims with children have a place to bring their child, power integrated furniture, and a computer allowing visitors access to internet resources. 2019, we also introduced a community court watch app that allows community members to track cases through their cell phone. Late last year, we launched phase 2 of our Together We Are Stronger campaign, continuing the public education push to remind residents about the support and services for victims and witnesses that we have in Baltimore City. We had a targeted push within that campaign for domestic violence. As Turnaround has reported, during the first 6 to 7 months of the pandemic, their call volume increased 300% compared to the same time period of the previous year. Reducing violence against women requires collaborative, data-driven approaches, as the previous speakers noted multiple times. So we look forward to continuing to work with our city partners, agencies, external partners to achieve this goal. I'll answer any questions that the council may have to the best of my ability, but if I don't have the answer on hand, whether it be a data point or technical question, I'll be sure to follow up before the close of business today. Thank you.
Thank you. And again, thanks for joining. Last, we're going to hear from the City Solicitor's Office.
Hello, Madam Chair. This is Hillary Ruley, Chief Solicitor from the City Solicitor's Office. Obviously, we approve the bill for form and legal sufficiency and welcome this kind of discussion. Thank you.
Thank you, Hillary. Appreciate you for being here. We're going to move into committee members for questions. I want to thank all of the agencies again for joining, for being open to this discussion, this much needed discussion, and for providing your thorough reports on this matter to the committee. At this time, I'm going to go ahead and start with my first question. My first question is going to be for Monty. Director Jackson, you did speak about the grant that you did apply for from the Office on Violence Against Women. And I know that you also spoke about a decision being made for it. You stated that it was about $750,000. Once this grant comes in, what specific programs or services will this grant support? And is there a plan for funding for funding that work if the grant does not come through?
Thank you for your question, Councilwoman McCray. I'm going to ask Nick Wilson to talk specifically about the work that is currently happening, because even though we haven't gotten grant funded yet, we are actively having conversations with partners in a collaborative way about domestic violence fatality reviews, and have been doing that for a few months now, in addition to the work that BPD was already doing before the formation of this office. So I'll have Nick talk to you about the work that's happening, and then I'll come back and piggyback on the second part of your question about funding. Nick?
Great, thank you, Director Jackson. So actually, we meet at least once a week with other partners to focus on the increase in intimate partner violence and domestic violence. Just on Monday, our lethal assessment program, lethality assessment program met with BPD transferring over to a new RMS system. We're seeing a change and a shift in how reports go from the scene of the crime onto House of Ruth. Before the switchover, we were doing working with the Office of Performance Innovation to make sure that all of our data, there was nothing getting lost, the numbers all matched up. Because of this change, we've been very grateful that BPD has answered all of our questions within hours and all of our concerns. And we are working with House of Ruth very diligently and OPI to make sure that our data is correct and that no victims are falling through the cracks, and that every victim that we're able to reach them immediately, offer them services, and work with all of our partners. So that's been something that's been happening as we speak. It's a top priority to make sure that we get this done so we can move forward. We have outlined several programs that we want to do, and we're going to move forward with, which Shante mentioned one, which was we've been doing a great job, I think, of providing victims with services and trauma-informed responses. But if we're going to prevent homicides, we really also need to look at the offenders and the perpetrators. We see a lot of repeat offenders, and we want to make sure that we do a better job, not only while they're incarcerated, but in the community and before they even get involved in the criminal justice system, that we offer these intensive supports as well as accountability measures and swift and certain and fair sanctions. If people, we want to send a message to Baltimore City, to the offenders in our community, that we're not going to tolerate violence against women in any form, and that our law enforcement, state's attorney's office, City Hall, we are going to put our resources to making sure that these behaviors stop. We are excited about the grant possibility. It's a very strong application, and I have a good feeling about what will happen. And this will just give us a lot more capacity to be able to implement a lot of the ideas that we have been kind of sitting on the shelf for a little bit. For example, we want to make sure that we put money in there so that BPD has more money for officers and victim advocates to really do these house visits, come up with these protective plans. We don't want to just react when something happens. We want to be proactive in doing that prevention. So that's very exciting. There's money for House of Ruth to be able to have a special program coordinator within their shop to be able to help do more of these kind of intakes and outreach and be more proactive in connecting with victims, and especially ones that maybe are more reluctant and might need a little bit more proactive outreach to get them to participate in some of these great programs, as well as money to expand the Baltimore City Visitation Center that MONSE operates. It's only every other week, and we would love to move it to every week, every day, being able to have this as another safe, supportive place, not only to do visitation, but that's also another great mechanism in place to be able to educate individuals about the services that we can provide. And so we want to make sure that there's more money also for a court liaison and program coordinators to really go through with a lot of this work. And we also expect, Criminal Justice Coordinating Council, the Domestic Violence Coordinating Council that Director Jackson mentioned. Everyone is very eager to get together and to engage, not just what the services and the providers we have right now, which is predominantly Mercy, House of Ruth, BPD. But we also want to include the court systems and probation and parole and other folks, so we can really make sure that we're doing everything we can, but this grant is really tailored for what we want to do, but we're going to, Director Jackson and I, we're looking at every single federal opportunity, state level. We are going to make sure that money is not the obstacle that prevents us from saving lives, because that's what it really comes down to, is these are preventable deaths and preventable abuse. And whether it's sexual assault, domestic violence, whether it's community violence, whether they're involved in street crimes or they're innocent bystanders that get caught there, we're going to make sure that these numbers go in the right direction.
Thanks, Nick. The only additional piece of information that makes sense to share here is that the VOCA grant that I mentioned that funds the sexual assault work is one that is coming up for renewal. In July, we anticipate getting the request to submit a new grant for this upcoming fiscal year. And so there is going to be an ask related to intimate partner abuse added to that VOCA grant as well. So there's work planned whether or not we get the $750,000 or not. The other piece that I'll add on here is if you all recall the 5-year strategic plan that the mayor has shared very publicly with regard to violence prevention, victim services is one of the core building blocks associated with that first pillar around a public health approach to public safety. And we do have full intentions to make sure that we are expanding our victim services support over the coming years.
Thank you. This second question is going to be for any of our agencies. Anybody can jump in here. That can be BPD, that can be our state agencies as well. That can be MONSE. Does the city have any intervention programs focused on changing the behavior of perpetrators of domestic violence? And what mechanisms are available to get perpetrators to participate in these programs?
Councilwoman, are you asking for programs in addition to the one that we just spoke about?
That is
House of Ruth just recently launched?
That is correct.
Thank you, ma'am.
And Councilwoman McCray, that's a really good question. We do not have any prevention tools. We still, again, we rely heavily on our partners. One of the streams that we use is through the Office of Parole and Probation, is to require a certain level of participation where these types of crimes are concerned. But again, that's a place that we rely heavily on our partnerships.
Thank you, Deputy Commissioner. For the State's Attorney's Office, do you guys have any intervention plans for perpetrators of violence?
Councilman, currently we have a program set up for low-level felony drug offenders, and we're looking to expand that program as we move forward, and we have been looking at grant funding for that. It's something that we can work with your office to try to define the scope of that moving forward, but not at this moment.
Thank you. For the Mayor's Office of Children and Family Success, I know that you guys stated that you're very limited in your role. You're likely sending these to other agencies. And I just want to verify, you guys don't have any intervention programs, or where are you referring people if they come to you for intervention in this issue, on this issue?
Madam Chair, so we work with MONSE or the Mayor's Office of Homeless Services when people are come into contact with our office. Typically, that might come through, for example, CAP centers. If somebody's coming to kind of request assistance with a utility bill or rental assistance, and they express to us that they might be in a situation where they are trying to set up an independent household, for example. We've also occasionally will get direct contact just to our office from members of the public who are seeking assistance or seeking services or programs. And so when the needs are expressed to either members of our staff inside the office or at kind of our community-facing CAP centers, that's when we typically would make a referral.
Thank you, Leah. We're going to move to Councilman Conway for his questions.
Thank you, Madam Chair, and I want to thank you for bringing this forward. You and I had a brief conversation because we actually put out similar resolutions on exactly this issue, but from a different perspective. And I think you bringing this forward with the public health perspective, I think is very, very important towards finding a sustainable solution and addressing the problem. I want to follow up on the question that you just asked, because it was one of my questions as well with regard to programs that we have to address offenders and not just to respond and jail them, but also to make sure that we can change that behavior so that they don't abuse their the person in their next relationship. For the few programs that we do have, it sounds like we're still kind of building that up. How do we coordinate with the police department? Do we have any pathways that are well worn, or do we have any systems that have already, been built up, much like we do for lethality assessments? We do a very good job of making sure that when a victim is identified and it's identified that it's a domestic violence issue, that we follow up with that woman, typically woman. We find housing for her. On the flip side, for the offender, what systems do we have in place to make sure that in every instance that we've identified that someone has maybe an anger issue and a proclivity towards violence toward their significant other, we can help that person out? Anyone can answer that question.
Thanks for your question, Councilman Conway. I would say that we are building those systems out. You've heard each of the agencies talk about the interagency collaboration that's happening, and not just happening from a lab perspective or lethality assessment programming perspective, but also taking a closer look at instances of intimate partner abuse and sexual assault through an interagency lens, so that we can identify both survivors of crime and perpetrators of crime. I would say that while the House of Ruth is getting us well on our way with regard to making sure that we're reaching as far back as we possibly can to educate, inform, rehabilitate perpetrators and potential perpetrators of this sort of violence, that from an agency perspective, we're really just beginning. And we understand that we're at the beginning. It's one of the reasons why the asks that we made via the federal grant that you heard both Nick and I talk about are so deeply rooted in making sure that we get back to the preventative side of this work. So your point is well taken, as is Councilwoman McCrae's, that we've got a lot of work to do on this. I will mention that in addition to House of Ruth, just as a reminder, that other programming that's coming directly from the Mayor's Office of Neighborhood Safety and Engagement that was mentioned by Nick, but may have been unheard, is that when we're in the visitation center every few weeks, that there are opportunities for training that we're providing to both parents, right? As it relates to being a survivor of crime and or a victim, and that Wendy Lee, who's been a critical team member on MONSE, has been a part of coordinating that training, because we can't forget about the children who are victims in this too, and who are dealing with going to a facility every 2 weeks to visit with a mom or visit with a dad.
Would the health department be able to kick in a little bit here on if there is any connection between the police department when we identify these instances? Do we coordinate at all? Do we refer these folks to programs? Is there anything going on there?
Councilman Conway, Deputy Commissioner Briscoe here, if I may, sir.
Sure.
So when I invoked saying the parole or probation, and I know that is not far enough upstream for intervention and prevention for where we would like it to be, I invoke them because that's also a partner that I know they utilize other supports. For example, Joe Jones and Center for Urban Families, when I'm saying that they're trying to invoke other partners to get participation and get interventions, that's another place that they use a relationship and resources to do that. For example, but so I cannot speak totally to their catalog of resources that they use. I'm familiar with some of their programming. I'm familiar with some of their personnel. But to give just some context, more context to the conversation, I do know that they use services to try to draw in the populace of offender.
Thank you. And I think it may go unnoticed. So I'll say this as well. We have to wonder for families that have children, what impact seeing domestic violence amongst their parents may have on their future relationships. And I want to give a little bit of thought to that and just kind of put that on the table for folks to think about, to make sure that as we identify each of these instances, one, that we are actually following through with the victims and making sure they have the services that they need. I see Dorothy Lennon going here. Hey, Dorothy, of House of Ruth, Maryland. But then also that we're thinking about the other impacts, of course, with the offender, and of course, when there are children and related family members in the household, that we get to those folks as well. My second question is about the data. I love data, you know that. I'm really curious if we see any particular trends in offenses, given location, age, income, number of children or children at all, and if there are things there that we can do to better tailor our outreach to folks. Have we looked at all into that data, or can we, as a follow-up?
Councilman Conway, Deputy Commissioner Briscoe again. I can tell you we look at that data, and just because we're in a public forum, what I would not want to do is compound the issues of our victims by mapping, and it's not hard to find it, but I just want to make sure I'm framing my speech in this arena in the appropriate way. I do not want socioeconomic status to be one of those things that the victims feel more victimized by, but there is a correlation between socioeconomic challenges and other challenges in our city that align with domestic violence and inter-partner violence. So we do look at that, and we do map calls for service, we do map offenders, and we do map response in that way. We do have that data though, sir.
Thank you. That information would be really helpful, if only to think about the pressures on families that lead folks to end up in those situations to begin with. I'm sure that when folks are dating, they're not thinking about the next time they're going to hit each other. So if we can think of use what we have at our fingertips, the data that we have on occurrences and arrests and otherwise, to inform our outreach services on the front end, I think it'd be really helpful, especially when we're talking about reaching out to victims and even more getting ahead of offenders, known offenders, so they're not repeat offenders, would be helpful. Thank you, Madam Chair.
Thank you. I do want to uplift Dorothy Lennon from the House of Ruth, who has joined us. We have spoken about, we've been speaking about the organization, and I want to make sure that she has an opportunity to add anything to this conversation that she wants to say at this time before we go into further questions. Committee members, Dorothy has also submitted testimony as well that is within your inboxes that you can review at a later time. But Dorothy, if you have anything that you want to share, if you can go ahead and share that at this time, please.
Thank you so much, Madam Chair, members of the committee. My name is Dorothy Lenig. I'm the director of the Domestic Violence Legal Clinic at the House of Ruth. And I think you're all familiar with the House of Ruth, but I'll just say we're a comprehensive domestic violence program. We serve victims of domestic violence throughout the state, but our services are located in Baltimore City. I can't thank you enough, Councilwoman McCray, for introducing this resolution. Obviously, the House of Ruth strongly supports it, and we really appreciate your efforts in raising up this issue within the city, because I think we can all agree how important it is. I don't want to repeat what many people have said, and many of you have spoken about the House of Ruth. I think we know that the supportive services that we provide to the victims that Director Jackson spoke so much about are really the bedrock of what we do and so important for making sure that victims are safe and able to get away from their abusers. But I think we can also all agree that we're never really going to end domestic violence until we focus on prevention. And so I just want to make 4 suggestions of things that as a council, as a city, as Monsi should maybe able to want to think about focusing on during this work. And I put myself at your service. I'm happy to help in any of this. And many of these come out of my work on the Domestic Violence Fatality Review Team, the Baltimore City Domestic Violence Fatality Review Team. The first one is I really think we need to improve our efforts to support young people who have experienced trauma from exposure to intimate partner violence. And everyone in the city, I believe, has taken a class on trauma-informed care. So I think you know how important trauma is. But we really want, the Fatality Review Team really wanted to focus on supporting the schools in identifying kids who have been traumatized. So the situation that we saw, and I think really brings this problem to light. There was a child who witnessed his mother being killed as a result of domestic violence. His caregiver then moved him to a different school because he had a new address, didn't tell the school that this child had been so badly traumatized. And then the child didn't get the services that he or she needed to really be able to make a recovery. So we were thinking of the health department or the Board of Ed or whoever the appropriate agency is to really start to make sure that number one, teachers and staff in school really has it. But in addition, that maybe school nurses be trained to really start to identify domestic violence, sexual assault, and other kinds of trauma to try to get children into the appropriate services. Because the other thing we saw in the Fatality Review Team is a child witnesses his or her mother being killed, and then that child goes on to have so many other problems. They end up in the juvenile system, they end up then in the adult criminal justice system. And we really want to stop that from happening. The second suggestion that we have is that Baltimore City should partner with an abuser intervention program to provide free drop-in intervention programming and group sessions for non-court ordered individuals. So another thing that the Fatality Review Team really started to notice was that there are very few resources available for men who could use help in addressing their own tendencies towards violence, either before they were court ordered or before maybe they were actually physically violent, but had become psychologically abusive or were exerting coercive control, but hadn't actually hit her yet or him. But most of our clients are women, and so it would be free. It would be drop-in, and it would be services that would be available before the court intervenes. So somebody, let's say you went to your clergyman and he was talking to you about your feelings that you might become abusive, or a friend or a family member or a job training program. It would be a resource to refer people to before there was criminal justice intervention. The third thing that we have been thinking of is I think we've all agreed, and everybody's talked a lot about all the coordinated responses to domestic violence, and it's alphabet soup. It's DVCC, DVFRT, DVSTAT, CJCC, all those organizations, and they were amazing over time. And I've worked with many of you on these, and they did some incredible work. I think towards stages of some of those and some of those committees, the agencies themselves were not sending high-level representatives or stopped sending representatives at all. So in a sense, I think we need to reimagine that coordinated effort. We don't just need to start up where we left off when some of these committees stopped. I think we need to rethink what we really want them to do. And I think we need to make sure the appropriate and high-level people are sitting at the table. When DVSTAT first got started and the mayor was really involved in it and had a high-level person running it, and the heads of agencies came or close to the heads of agencies, we were able to do amazing things. But when decision makers stopped coming to those meetings, then the effectiveness of those groups, I think, waned. And finally, I think we need to expand the opportunities for rapid rehousing. The House of Ruth does a great job of sheltering women who are fleeing from domestic violence, but we need to quickly get people into more permanent housing with services. And I know housing is an issue throughout the city, and it's an issue that we worry about for a lot of people, but I think we need to add victims of domestic violence into the group of people who are potentially homeless, who need to be in more permanent housing with rental assistance, with counseling, with job training, and all those other supportive services. So I'm happy to answer any questions about anything I've said or anything about House of Ruth services. And again, I just want to thank you so much, Councilwoman McCray, for bringing this forward.
Thank you. Thank you so much, Ms. Lennon, for the work that you do and all the workers at the House of Ruth. We truly appreciate you. Committee members, we're going to move back to questions. Just know that Ms. Lennon will still be here if we have any questions directly for the House of Ruth. Councilman Torrance, at this time, did you have any questions?
Yes, Madam Chair. My question is more related to coordination, similar to the Director of House of Ruth. I know that City Schools does training for staff and it's required every year. The question is, how are we coordinating with other agencies in terms of realistically having relationships? Because what I've learned is, what training are we providing not only staff of City Schools, but BPD and others on relationship building? Because as a person who was a child in a household where there was domestic violence, trust for a woman is important for her to be able to be willing to move forward. So I'm wondering, how are we training people to create that trust and then create the follow through to continue to build that trust?
To tie into Councilman Torrance's question, does the health department just mind speaking about their Data Matters curriculum? I think that ties in well to his question, if you guys want to talk about that at this time.
I sincerely apologize, but Director Calabrew, who is the lead with that program, he's unfortunately not available. But I'm happy to convey this question to him so that he can respond, and we'll get that response to Councilman Torrance.
To add to the request of Councilman Torrance, since our Director Calabrew is not here at this time, I'm requesting more information on if there are plans to expand that program outside of just the 4 schools. I believe there are 4 West Baltimore schools. If there are plans to expand that program to other schools across the city.
So I can speak just briefly to that. As I understand it, this is a 5-year grant that we have, and we're in year 4. So the chances of us being able to expand, I think, are limited. But let me be sure on that matter, and I'll get back to you on that as well.
And Councilman Torrance, thanks for your patience. Are there any other agencies that can address this question or want to take a shot at this question? Okay, so I'm going to go ahead and just call out an agency. Monty, Director Jackson, do we have any programs that are working with our youth on building healthy relationships?
Yes, and I would also ask Leah, as the representative of the Mayor's Office of Children and Family Success, to chime in here. There are a few community-based organizations that come immediately to mind with regard to the social and emotional welfare of our children, whether they reside in homes where intimate partner abuse is happening or not, but have specialized case management and casework happening in cases where we have identified that that's happening. Leah, I would really defer to you here, given that MOCFIS is the expert in this space.
What I would say in this is that while the city is not a direct provider of programs or services that promote healthy relationships among young people, I know that Baltimore City Public Schools has programs that are available to students within those schools. Not at the moment familiar with the degree to which they're available, if it's something that every child will be exposed to, along the course of their K-12 experience, or if it's more targeted in how those programs are provided within school buildings. But I can definitely follow up with the school district and try to get more information.
And Councilwoman McCray, if I may, ma'am, again, Deputy Commissioner Briscoe, I know we were doing the Handle with Care program in response. Like, if we received a call for service and we knew that there was a child present, that there was a level of notification being made to the schools, not necessarily at the total events, but just to be aware that there was a particular child present during an act of violence, and we would respond with giving that child a stuffed animal. was hesitant to find out where are we with it, because of course, as you very well know, schools have been closed for such a long time during the pandemic, and just how we were showing up beyond that notification piece to the schools. But we were participating in Handle with Care, where our young people are concerned in violence.
Chair McCray, I'm also joined by Assistant Commissioner Rebecca Deneen, who wanted to have an opportunity to speak on this matter as well.
Okay.
Hi, thank you. The one thing I was going to say is the health department works very closely with city schools right now on our sexual health curriculum. So all middle and high schoolers now have an evidence-based curriculum that deals with healthy relationships. And the identification of a child who may be in an at-risk situation is not the purpose of this curriculum, but the purpose of this curriculum is actually more around prevention. So it is in terms of sexual health decision-making, in terms of better decision-making for relationships. So that was introduced about 4 years ago through a federal grant. Now through COVID, it's been a little bit less evident how much that's been implemented. But as soon as schools are sort of back into service, that is part of our work with the school system.
Chair, I would also mention we have attendee of this hearing, I apologize, who represents an organization that provides meaning and engagement with young people in healthy relationships, and she's intending to provide testimony when we open it up to public comment. But if you were interested in having her share comment now or wait, I just wanted to make you aware.
Okay. Thank you, Leah. Councilman Torrance, I'm going to throw this back to you. I didn't mean to hijack your question.
No, no worries, Madam Chair. So like the gap that I see and I'll be just transparent in the presentations is that we focus on, the conversation didn't rely back to what the core essential for moving persons out of these incidents or the behavior or even protecting people. It requires trust. It's something that I found even in work constituent services here, is that the underlying movement in order for successful programs is trust from our citizenry. So the question is, what are we doing to build that trust? And I just want to make sure that's a request to see, like, have we actively trained or actively done the groundwork to create the empathy and the trust in our agencies or in our work groups to create opportunities for women to actually leave these abusive relationships, or get the resources for their partner, or even better, how are we building trust among the men to even break down, men or women, apologies, to break down their own abusive behavior towards their partners as well? Because the essential to moving and pushing people to change is trust, and essentially when we offer these resources. My next question is more so related to coordination. Do you guys annually have a report on where your coordination is? Because what I've found is that we have work groups and task force, but we never have outcomes for what those task force or work groups have. And I would love any information that you do have for like what your outcomes are, or how many persons have we successfully removed from situations? How many people have we counseled? and how have we done the follow-up? Because one of the things I've learned in city government so far is that we don't have linear studies on what our successes are, and we don't follow through with the case management beyond just initial intake often. So if you have any of that, I would like to make that request if you can provide it to myself and the committee. Thank you.
Thank you, Councilman Torrance. I want to welcome Ojeda Hall from the One Love Foundation, and I'm hoping that she can offer some insight into your first question about some work that's being done across Baltimore City. Now, we're moving in a different format this time. So, Ms. Hall, anything that you want to share at this time, you do have the floor.
Yeah. Thank you so much. I will scrap what I was going to say before because this has been the exact conversation that I've been wanting to be in for the last 2.5 years that I've been executive director at the One. So the One Love Foundation was founded, many of you may know, in the honor of a young white woman who was killed at the University of Virginia. Her name was Yardley Love. I came on about 2.5 years ago, committed to ensuring that One Love really brought its programs into Baltimore City with depth into Baltimore City schools. I came hoping that we would be educating more young people that look like me. And so let me give you some stats quickly. In Baltimore City, we've educated 18,675 young people in 242 workshops. Our model is a train the trainer model, and we've educated about 800 trainers. And we have a Baltimore City school network of educators who are learning the One Love curriculum, content, our film-based approach, which is in high schools, including City, Poly, Baltimore School for the Arts. I'm getting a list now from my team now. Dunbar. We've been training in essentially a saturation type approach where we're trying to get to every student in high school. We testified at the Maryland State School Board to ensure that there was more time to teach health in Baltimore, in all city schools school systems across the state, because teachers were really pressured by not having enough time to teach health. And so now high schoolers have an extra half credit of health to ensure that they can get all of the health standards in. And we have aligned our content to the Maryland State Health Standards. Now, what does all this mean? What this means is that for the last several years, we've been creating film-based content that reaches young people where they are in social media to be able to talk about the early warning signs of unhealthy relationships. We are the prevention strategy. I've been like dying here, like, please let me in. We, partner with House of Ruth, Turnaround, GBMC, truly appreciate the work that they do. And we want to be part of that comprehensive approach, which has to include prevention and has to start young. So we start in middle schools with our couplets curriculum. We're also building out new film as well. And then we have moved through high school and then through college, all for the purpose of reducing those statistics, which most of you know, 1 in 3 women, almost 1 in 3 men, 1 in 2 trans non-binary people, and 1 in 3 teens will be in an abusive or intimate partner relationship in their lifetime. I do this work, born in Baltimore, born at Sinai Hospital. Both of my grandmothers were victims of domestic violence. One lived at 3615 Spalding Avenue, the other at 3200 Presbury in Walbrook Junction. Both were victim survivors of domestic violence, and they had all of the ancillary problems. My grandmother, one died from diabetes, one died from cancer, one was an abused alcohol. They had mental health issues. They were angry, depressed, and that generational curse landed in my generation with my cousins, many of us of whom were in abusive relationships. My younger cousin was almost shot to death by her boyfriend. She was a student at Temple University. He killed himself. She's back in Baltimore. She survived that, and her children ask her when she takes off of work every day in February in commemoration of what happened to her, "Mommy, what happened to you?" And she says, "Oh, Jade, I'm so glad you're doing this early healthy relationship education because kids need to be educated earlier and earlier. So we have an online education center. It's called the One Love Education Center. You go to www.joinonelove.org. It has 150 different resources. It has video content based on what happens when a young relationship escalates. It looks good in the beginning, and then you see the 10 signs of an unhealthy relationship show up, and then you see and then we begin to talk about how to move those relationships to healthy relationships. We have a resource library. We have content in English, Spanish, and Chinese. We have LGBTQ plus content. We are ready to partner with the city agencies, the city council on getting this comprehensive education out to young people, because without a prevention strategy, we're going to be doing this forever. We're going to invest hundreds of millions of dollars in this problem. And we are ahead of the curve, creating content every day that looks more and more like the students of Baltimore. We have the Wide Angle Youth Media creating a piece of content now for One Love to get into Baltimore City schools in a deeper way. So I'm going to pause there because that is not actually what my public comment was going to be. But I wanted to let everyone know we are not without solutions, and One Love definitely wants to be part of the solution and in this ecosystem with House of Ruth, with Department of Justice, with the Baltimore Police Department, with you, Councilwoman McCray, with others on this call to solve this problem, with the mayor's office to solve this problem. We are here, we are ready to work, we have staff to work, we are open to making our content work. We are, and the last thing, I will say another thing, we trained 60 social workers and student personnel. We've worked with the Maryland State Department of Education to ensure we're working with their safety team. We are getting into schools, and actually would love to work with all of you on a back to school teen dating violence town hall for all the schools in Baltimore City, so that we can start the year off and start the communities, school communities off with a broad understanding of the 10 signs of a healthy relationship and unhealthy relationship and violence this year. We need to do it.
Ms. Hall, I want to thank you for joining, and for the members of the public, I know that this is not my traditional format, but one thing that I wanted to make sure that we highlighted, and it was stated within the introductory resolution, is not just our agencies, but our community-based organizations that are working on this problem too. So we wanted to make sure that we are highlighting them. And Leah, thank you for making me aware that Ms. Hall did need to be elevated. I do appreciate that. For any additional, do we have any additional questions from members of the committee at this time? Okay, I still have some questions, y'all. So I'm going to cycle through some more of my questions since we have some more time to make sure that we get the stuff on the record. For our Baltimore City Health Department, the Youth Services and Advocacy Project does a multitude of work serving the primary and secondary victims of violence. We know that the YSAP has provided funds towards relocation. Annually, do we know how much funding that program was able to award, and has that funding decreased due to the COVID-19 pandemic?
Again, Councilwoman McCray, Chair McCray, my apologies, but I'm not joined by Director Keller Bruce, so unfortunately I can't speak to that. But I'm happy to get back to you with the proper response.
Okay, so we'll make sure that we relay my questions for the health department just so we can get a response to you. And I'm going to let you, DePaul, I'm going to let you guys slide a little bit today because I know that we're recessing this and we're going to come back eventually for it. I'm going to move to the BPD, to Deputy Commissioner. You gave us a lot of crime stats earlier on within the hearing. And with the level of violence that we've seen thus far, do we have any type of crime enforcement strategy to slow down the pace of violence that we are not just experiencing against violence against women, but violence in general right now?
Thank you so much, Chairwoman McCray. It's a really good question. Crime reduction strategy and plan, one overarching larger one and one that is geared toward this summer deployment. Though we do not necessarily focus on gender, we focus on geography and the agenda and the geography and the persons based on what they're doing. So we have a persons-based strategy and a place-based strategy. And I know we will get more into that when we meet with you in detail. But to answer your question in short, ma'am, yes. And if I may follow up, when I listened to Councilman Torrance's question, he was asking, was there training? And I thought if he didn't hear me in my opening, I want to make sure I key it up again so that he can hear me about the training. Where that's concerned is that we've taken our officers through a mandated sexual assault training that is geared toward ensuring that our officers respond to build trust through patience, compassion, professionalism, and refrain from expressing blame and judgment and disbelief with the victim. The training is geared toward building trust and having a professional response for any sexual assault and violence related, male or female, because we do know that domestic violence or interpartner violence is not solely geared toward women, though that is the focus for today's conversation. I wanted to make sure that I made that point very clear. We are training to that point. And I hope that answered your question, Councilwoman McCray. Chairwoman, I apologize, Chairwoman McCray.
Thank you, Deputy Commissioner. I'm going to move back to Monty. I'm not sure if Director Jackson is still here, but I do see Nick. You guys did speak briefly within your report, well, not briefly, within your report, and you spoke briefly on this earlier. You explained that the sexual assault response team regularly reviews all sexual assault cases that BPD identifies as unfounded, and that the reviews have led to a dramatic reduction in cases identified as unfounded. What has BPD done to ensure that sexual assault cases are properly investigated and classified without waiting for the response team review? And that actually might be for both agencies.
Nick, I'm going to defer to you on that one and lean very heavily into the Deputy Commissioner to answer the question about what BPD is doing.
Great. I'll frame it, and then I'll let Deputy Commissioner Briscoe get into a little bit more of the operations of it today. So when SART was established, we realized that our percentage of unfounded cases, which is officers coming to the scene and making a decision whether or not this is something that should be classified as a crime and investigated, that was at a much higher rate than we've seen at the national average. And that was very concerning. And so through a lot of work with advocates and police and the rest of the SART team, we've been able to get those numbers down to what we believe is a true reflective unfounded rate and what is in line with the rest of the country. This has been a remarkable success in a very difficult issue. And so we've been very appreciative of the police department doing a lot of training, a lot of education around when to determine if a case is unfounded and when not to. And then moving forward, they can start the investigations. I will say that SART, because this has been a big accomplishment, we feel like we've gotten this problem to a manageable area where we're looking at really what is the next steps for SART. And we're very excited about a lot of the ideas. And we are going through case reviews. And of course, sometimes when we're looking at open cases, which are usually more helpful because they're more recent, and BPD has done a lot of great improvements in how they respond to sexual assault. So looking at old closed cases, maybe not as being informative, but that said, with new cases, there's other challenges, especially with cooperation from maybe the state's attorney's office, who doesn't want to be involved in an open case process, which might affect the prosecution. So we're very careful about and sensitive to this information. But I'll turn it over to Briscoe to talk about the investigations today.
Thank you so much. So you've hit on many of the points that I was going to make, Nick. So thank you for that. We're appreciative of our partnership with SART. Sorry, my video is having some technological issues. So we're appreciative of our relationship with SART. I can tell you that training was really what helped to curb a lot of that challenge that we were experiencing, making sure that we're showing up, hearing our victims, our complainants, and from the very onset of that complaint, fully and thoroughly investigating it and allowing the specialists that are more trained and thoroughly trained to deal with those types of complaints to see that case. So that case has less of a chance to be quote unquote unfounded. So it goes through a longer process, but training is really what helped to stave that off. And thus far, I had Major Bishop pull some statistics. We've had only 5 unfounded sexual assaults, because again, we take every complaint seriously and we walk that through the process. And so we're appreciative of SART that helps to hold us accountable and review our case review. So we're not waiting for that. We put other protocols in place to include a case checklist that ensure that every case was being investigated, but with a standard. One of the things that we knew that it was prior to 18 or 19, there was a lack of standard as to how the cases were being investigated. So we closed that loop by putting in protocols that require a certain level of process and step that can be evaluated and audited internally for standard and compliance. So those are the things that we're doing to stave off any unwarranted, unfounded calls to service where this crime is concerned. And I hope that answered your question.
It did. I just want to make sure for my other committee members who are still hanging in here, there are no additional questions at this time.
Chair McCray, sorry, this is DePaul with Health. I actually have Director Calabrew on with us now. So if you would like to revisit some of the questions from earlier, he's happy to field them.
Okay, perfect. Let's get into a few of these questions. Bear with me just a few moments.
Madam Chair, if I may, I just want to thank the Deputy Commissioner for lifting up the training. That's where I was getting towards, because with a family set training is important when interacting with complainants or partners, because what we've learned is that empathy and that trust without judgment and being mindful of bias in terms of patriarchy and sexism allows us to get partners out of those situations. And I thank you for lifting it up, Deputy Commissioner.
Yes, sir.
And thank you, Councilman. Director Calabrew, thanks so much for joining. I had a few questions about the Data Matters curriculum that we had. I just wanted to know, does the department have any data showing the effects of that program in preventing dating violence? And are there plans to expand it to more schools in the city as they reopen? DePaul did share that we are in year 4 of a grant for this particular program, but are there plans to expand it? Is there data to show the effects of the program actually working? Is it actually preventing dating violence?
So, good morning, Council Member McCray. So the first answer to your first question is, overall, Dating Matters has shown effectiveness across the country. There are other sites that have shown effectiveness, including us, over the past. And we actually implemented Dating Matters for over the past 9 years. But the program, and so we started in schools, a while ago. But we got new funding that gave us another opportunity for another 5 years. So we're in that second set. And so I can pull some data for you in that first set in terms of the effectiveness of the program. But the new iteration of this over the past 4 years, we have served 800 or so youth. And I can share some data with you. I think I can gather that for you. I don't want to misspeak on the actual data, but we have shown some effectiveness for the program overall. To prevent teen dating violence, if you will. So I would have to get back with you on the actual data, if you don't mind.
Okay, can we just make a formal request that you just provide the data to the committee? I would appreciate that one. I'm running very quickly. I want to be respectful of time because we only have the slot until 1 p.m. But I did have another question. It was regarding the Youth Services and Advocacy Project. I know that particular program does a multitude of work serving primary and secondary victims of violence. And I wanted to know if the YSAP has provided funds. We know that the YSAP has provided funds towards relocation. I'm looking to find out how much funding has that program been able to award, and has the funding decreased due to the COVID-19 pandemic?
So the first question is around how much of the funding. I would have to get back on you how much, but I do know that we have served about 40% of the sort of 97 victims over the past since October. 40% of those families have needed urgent or emergency housing, from whether it was relocation from a domestic violence situation or whether it was because of an eviction. So we have been able to support those families in terms of relocation, whether it be in the city or beyond the city. We have helped them out. So I can get the exact number for you if you have a request for that. I can get you that number specifically. Again, don't want to misspeak there. And your second question was focused on what again? I'm sorry.
Has the funding decreased
Yes.
due to
Yes.
COVID?
Well, in fact, the funding decreased in the last administration under the federal administration. And so it decreased from about $300 something thousand, approximately 300 something thousand, to about $167,000. And we got a message from the administration that they were downsizing and took a lot of funds away across the country in terms of victims of crime. Funds that serve victims of crime. And so we weren't solely in that situation, but it only focused on staff. So they only wanted us to actually focus on staff with the funding. So we had to decrease by one person in our field there, one staff member. And so we're really at bare bones, if you will. So we've had the funding go towards staff and the housing component of our work, and then the mental health services component of our work. So it's not enough money to do what we need to do in this city in terms of the shootings, the homicides, and response to victims of crime. We know, but it's the only funding we have. We do not have city funding per se to go toward this. We do have a general fund that supports positions like, myself as a director and others, but there's no one currently from YSAP program who is funded through the city at all. So we rely on those VOCA funds from the state to be able to do that. And again, they were cut not because of COVID, they were cut because the last administration decided that they wanted to usurp those funds. And I don't know whether it went towards a wall or what it went to, but we were cut. So we're looking forward to this new administration and seeing where this leads. We're being hopeful, but the continuation of this funding happens every year, and we get that funding. So the announcement hasn't come out yet, but we have to do a continuation application for September 30th, 2021. So we have shown effectiveness in our work. We have shown that more than 77% of our victims believe that the resources that we have helped them out. They believe that they felt safer because they're in this program. And so that's, and so we have to continue this funding going forward. But again, the city does not support the program in terms of any staff at this point, or in the housing component as well. All the funding comes from the state.
Thank you so much for joining. Councilman Torrance, did you have any additional questions at this time?
No, ma'am, I do not have any additional questions, but I'll await the data.
Yep. Chair McCray, just so that we're being fully responsive, I know that there was a question earlier about building trust from Councilman Torrance about what we do around that, and then our programs to foster that trust. And so, William, I think maybe you could perhaps address that.
Well, yes, absolutely. I'm sorry. Go ahead.
Chair, is it okay if he's here? Shares.
Yes, it is.
Yeah, Betsy McAllister Grove said that trust is the first casualty of early abuse. We understand that trust is at the center of healthy relationships and also healing. Healing happens in relationships, so it's important to start there. And so we have a staff that has been trained in terms of doing screenings for whether it be domestic violence or other victimizations. And we, in fact, by the way, our program is funded by the state, so we not only serve individuals in Baltimore, but we actually are supposed to serve the entire state as well if there is a case. So building that trust is key, and our staff is very equipped at building that trust in relationships and doing case management to ensure that we follow through with victims of crime to get the resources that they need. And again, the satisfaction surveys that we put out have shown that more than 77 to 80%, in sort of three different questions. One is, are people safe? Do people feel safer because of the services they receive? Do they feel like the resources they receive? And so we have high marks and high rates on their trusting of the program. And so there are other elements, obviously, that build trust, but those are some key things that we've done, is ensuring that our staff is trained. Oh, and also our staff just went through the Roper Victim Assistance Academy of Maryland, which is one of the premier victim services academies. I have been trained at the National Advanced Trainer Institute from the Department of Justice, as well as the DC Victims Services Academy. And now this is our third academy that we're in, ensuring that we understand how to serve victims of crime across the board. And so we do have our staff trained. That is the most important thing to have, is that we're culturally sensitive and that we're also and that we're trained in terms of serving victims of crime.
I'm going to say thanks so much for joining us, to all of our agencies, to all of our community organizations, Ms. Lennon from the House of Ruth, and also Ms. Hall as well, for sharing your information. We're going to move into any public comment, public testimony that we may have regarding it. The committee staff is going to call on members of the public who wish to testify on Resolution 21-0039R. Members of the public, just signal, raise with the raise hand function to indicate that you wish to testify, and we will start with you. Matt is going to provide any additional instructions needed at this time.
Thank you, Madam Chair. I do not see any raised hands for attendees who would like to testify at this time, and we do not have any callers.
Okay, and Ms. Hall, I wanted to circle back to you. I know that you did have public testimony.
Thank you, Chairwoman McCray. So good afternoon now. My name is Ojeda Hall. I am Executive Director here in Maryland for the One Love Foundation. We are an organization that is dedicated to the prevention of teen dating violence. And thank you for the opportunity to speak today in support of your resolution to discuss the rise in violence against women and strategies that can be put into place. We are a prevention strategy. We are a primary prevention strategy. We have been the primary youth prevention strategy across the country, educating 1.4 million young people in every state in this country, 200,000 in Maryland, and as I stated earlier, 16,000 in Baltimore. I do this work because it is personally significant. I got a ton of violence against women books on my bookshelf back there because my mother and my grandmothers, my cousins, the generations of my family have been victims of violence, including myself. So generational curse that I want to see broken. As I said, One Love began out of a relationship tragedy, that of Yardley Love, and her mom understood that there were signs that they had seen in the relationship, that if they had only known what they were seeing, if they could have identified those signs, they could have prevented her death. And so she's created this organization to provide free resources, and it's a film-based train the trainer model to get to young people and their trusted adults at their point of need, meeting them in a language that they can understand. So we create educational tools and workshops that young youth-facing organizations, including schools, community-based organizations, can use to ensure their young people have a common language. So when you see the 10 signs of manipulation or isolation or guilting or belittling or deflecting responsibility, we've created those 10 signs out of the 2010 tragedy of Yardley Love. And that's the work that we've been pushing into schools for the last several years. We all know, I think we talked about today, we have a domestic violence pandemic within the COVID pandemic. And as we talked about the stats, but 80% of parents don't think or know if teen dating violence is an issue. And after COVID, that problem is even more widespread. It's in every community. And we need prevention approaches targeting young women, especially young women of color and LGBTQ women. We have created a full LGBTQ workshop. We've created workshops for disabled youth as well. We are supported by, and we partner with the Maryland Center for School Safety, Free State Justice, the Baltimore Ravens, the Maryland Office of Crime Control and Prevention. In fact, we had a VOCA grant in 2019. So what we've learned is that women are isolated, they are depressed, they're increasingly using social media for friendships and dating. The whole structure of relationships and dating has changed. dating, the whole issues around safety and safety planning have changed. They have a certain social media aspect to them, and that young people need more mental health, social emotional support, and trauma-informed support now more than ever. I think, and lastly, I'll say the true measure of what a city and a society is in its support for its women, its girls, and its children, and in how much time and resources it dedicates to the success and the health of girls and women. So we're excited to start the conversation. Starting conversations is literally what One Love does. We are an organization that teaches non-experts to start the conversation and teaches young people how to help their friends. And I think helping friends, when you are uncomfortable, perhaps going to the police or going to the government, whatever, is where we're going to begin to really see a turnaround in this scourge of violence against women. We have to put the language and the tools in the hands of ordinary citizens who do not have to be experts, but who know what the signs are and who can advocate with their own friends. So this relationship health is a root cause issue of the mental health, the violence, everything that we're seeing in the city. It's imperative that we recognize this truth and do what we can to ensure that our women and girls have what they need. Thank you, Chairwoman McCray and the council.
Thank you. And that's going to conclude our public testimony. Again, I want to thank all of the members, the few members of the public who are watching right now, the many who I know are going to watch on YouTube. I want to thank our agencies for being here. I want to thank our community-based organizations who are fighting this fight with us. The committee does plan to hold additional hearings on Resolution 21-0039R in the coming months. This hearing is now in recess, and that does conclude the hearings for today. Thanks for hanging in there with us during these 3 hearings, and we thank you for joining us throughout the morning and this afternoon. Everyone have a great day.